am going to perform lavage irrigation to an NG tube and NG tube removal. First, I'm going to verify I have an order for irrigation. I have an order for irrigation at 2 p.m. on March 31st, and I'm going to irrigate with sterile water, and I am going to prepare my equipment. I have a 50 ml syringe with a blunt tip, sterile water, the NG tube is in place, and I have gloves and also tissues for my patient. I am going to perform hand hygiene, and I'm going to identify my patient. I have Mr. John Doe, birthday 5990, which matches the medical record with the physician's order. I am going to explain the procedure to my patient and provide for privacy. Mr. John Doe, I'm going to irrigate your NG tube, maybe give you some relief, and we're going to see what's going on in your belly, what kind of contents you've got in there. I'm going to apply my gloves, and I'm going to verify placement of my NG tube. The NG tube is 55 at the nair, and that's what it's marked at, and I would measure the length and compare with the patient's chart. I would perform an abdominal assessment by look, listen, and feel. I would position the patient at a 30 to 45 degree angle, just like I would for a tube feeding. And I am going to clamp the tubing, which it is already clamped. I am going to instill 30 mLs of sterile water into the tube, and there's no resistance met. I'm going to push it slowly and evenly, and I'm going to reclamp my tubing and remove the syringe. I'm going to I would aspirate gastric content and measure the aspirate and the characteristics of the aspirate and document. I'd also check the pH, which should be less than 4. I am going to instill air into the blue tip. I am going to reconnect my patient back onto suction and make sure that everything is patent and flowing regularly. And I'm going to re-perform the abdominal assessment, look, listen, and feel to all 4 quadrants, and I'm going to document my procedure, perform hand hygiene, and prepare to remove the NG tube. To remove the NG tube, of course, I'm going to verify that the physician has ordered for the NG tube to be removed. I'm going to identify my patient with 2 identifiers, and I'm going to provide for privacy and explain the procedure to Mr. John Doe. Sir, you're feeling much better. You have no gastric discomfort, so the doctor has ordered for us to remove your NG tube. What a relief that must be for you. I'm going to lower the patient to a Fowler's position, actually a low Fowler's position, and I'm going to perform hand hygiene and don gloves. I'm going to remove the patient from the suction, so I'm going to switch the suction off. I'm going to remove the suction and clamp the tubing to prevent spills. I'm going to irrigate with 30 mLs of water, or correction, air, to make sure that the tube is clean. I'm going to reclamp it. I'm going to instruct the patient to take a deep breath. I'm going to remove, well, prior to taking the deep breath, we're going to have the tape removed. I have a trash can next to me. I have a towel draped over my patient. Tubing is clamped, and we're going to pull the tube out. Ready? Deep breath, Mr. Doe. 1, 2, 3. And this, of course, would be unclamped from his gown. Immediately dispose of the NG tube, clean his nair, provide oral care, and I would document and perform an abdominal reassessment and pain assessment and notify the physician and perform hand hygiene and assist my patient back up to a position of comfort.